When Birthing Better Families developed the body skills in the 1980s, because the cesarean rate tripled at that period of time, due to so many changes in society, which I talk about in other videos, we were beginning to really fully understand that the pelvis is where we need to focus on. Breathing's a good thing, communication's great, touch is effective. However, the baby has to come down through and out our pelvis, and in the process, open our cervix, which is inside our pelvis. It was obvious that the bony pelvis was surrounded by soft stuff, and soft tissue, fascia, connective tissue, is a complicated and diverse system in our body. We have skin, that's soft tissue, that's connected to our muscles, ligaments, and tendons, and all of the white stuff that's connected to all the bones. Everything's connected. It's connective tissue, soft tissue, or fascia. When we were developing the skills, the body skills that were in the pink kit that Jeannie had, that was just the body skills. The overview of the bony pelvis and the soft tissue, the skills to open up the bony pelvis, and skills to use the soft tissue to help create space and mobility in the bony structure, and how the soft tissue can impede that motion. And we have another video on tension, which explains the 4 types of tension that can exist within the soft tissue. Mostly we don't realize we have tension in the soft tissue. It can be conscious tension. We can do that. That's conscious tension. We lift the soft tissue, the muscles, and we're lifting the bones as well. But it's being done with the soft tissue. But most of us aren't aware of our unconscious tensions. Most of us aren't aware of our structural soft tissue tensions or our stretching tensions. The stretching one's easy to explain. Get up now and do a split. Oops, hurts. Stretching, soft tissue. So now you know what that is. Structural, when you learn to do the internal work, you'll realize that there are areas of the soft tissue inside that are tight or painful. That's structural. The unconscious or subconscious tension we are not aware of. But as I said, if you see someone walking down the street with a shoulder up or a head to one side, that is unconscious tension in your soft tissue. What we learned was that the bones have the ability to move, but to move them, we have to move the soft tissue. So for instance, in the video on the bony structure, I had you tuck your tail between the bones you're sitting on. That means you're moving the soft tissue that's moving the bones. Then you can untuck your tail. So you're moving your sacrum using your soft tissue and your mind. As I mentioned in another video, the soft tissue does not respond well to the word relax. And how did we know that? Because there were many women in labor who were facing the wall with their hands up on the wall, up on their tippy toes, with their bum muscles clenched tight and their shoulders up to their ears. And midwives, doctors, obstetrical nurses, partners, and friends would say to the women, just relax. And the woman would glare at them and just go, you try, I'm trying, shut up. Just drop your shoulders. Babies aren't coming out your shoulders. Just get off your toes. They're not coming out your toes. Rarely does someone say to you, unclench your butt. But it's not the external of the soft tissue that's the problem. It's the internal of the soft tissue that's the problem. So here's an example. You've heard about belly breathing. The lungs aren't dropping down to the belly. The breath isn't escaping the lungs and going down. You're just merely expanding your belly as you're inhaling into your lungs. You belly breathe. But we discovered that you can drop your breath down into your pelvis and expand inside your pelvis. So just do that now. Breathe into your pelvis and feel what happens. You don't feel a lot of motion in the front of your pelvis. It's more likely to be in the back, your sacrum, and some on the sides. That's how we can create space inside for our baby by literally inhaling and expanding inside the pelvic clock. And what's the pelvic clock? The pelvic clock is the top of our vagina. All of the tissue that's attached to the inside of our pubic bone, the inside of our hips, where our leg bones meet the hip blade, the middle part of our sacrum, and the cervix hangs down in our vagina, and the uterus grows on the top of that tissue, the pelvic clock. And when you have a contraction The contraction retracts this tissue so that at 10 centimeters, this whole space that you see when you look at a pelvis is open. And that is hard to imagine. But we knew that if women had tension inside their pelvis, consciously, tighten up down there now, that's tension. You've created it. You can just suck in your belly, pull your hips together, pull your sacrum to your pubic bone. That's tension. And that can stop the wave of the contraction from retracting the tissue of the top of your vagina back into those bones. And that's called a failure to progress. And that can lead to a very long labor, which can lead to a cesarean birth. There's a difference between a cervix that doesn't dilate and a baby that's stuck in the bony pelvis. But for want of the same thing, we are dealing with how to create space and mobility inside our pelvis so that our body can function effectively during labor. So when you breathe in now, expand inside your pelvis. And when you breathe out, go around the inside of your pubic bone, the inside of your hips where your leg bone meets, and the middle part of your sacrum, and soften. So expand in with your inhale, and as you exhale, start to soften inside that pelvic clock. This is focused breathing in birth, and we as Birthing Better Families use this skill to maintain the flexibility inside our bony pelvis by making certain that there is no tension in the soft tissue of our body. We talked about the soft tissue of the vagina and the importance of internal work in another video. When we work with the soft tissue, we are more likely to have a positive impact on how easy it is for our baby to dilate our cervix and then move down, through and out the 3 inches of the birth canal.